Welcome, everyone. Thank you so much for this important opportunity. We're very excited to bring you the details about this innovative project. Thank you to MEC2 and those in attendance today from the Government of New Brunswick. We're grateful to MEC2 and to GNB for this opportunity today. We'd also like to acknowledge those from NBCC who've made this program possible. And they include Anne Drennan, VP of Academic Innovation and Student Affairs, Ray Hubble, Dean of Health and Wellness, Simon Potter, the Director of College Office of Research Enterprise, or CORE, at NBCC, Scott Henwood, Head of CORE, and our research team, many of whom are listed here on this slide. Before we begin our presentation, Dame Levitt, who has worked as a professor in the Fine Arts Department at Brock University, is a proposal writer here at NBCC. She and her team have put together a moving interpretation of what it's like to live with COPD and to be impacted by our student-infused pulmonary rehabilitation. So I would invite anyone who's interested to watch this moving video, which we can forward to you at any time. We'd like to thank our funders, the Healthy Seniors Pilot Project and the New Brunswick Community College. We'd also like to thank our research team at NBCC, UNB, Research NB, and the University of Manitoba, as without this collaboration, we wouldn't have the product that we have today. What is chronic pulmonary obstructive disease? COPD is a group of diseases that cause airflow blockage and other breathing problems. In the form of emphysema or chronic bronchitis, the main symptoms of COPD include mild to very severe shortness of breath, chronic cough, and sputum production. COPD can negatively affect physical, mental, and social health, as well as the ability to work and participate in the community. There is a significant economic impact from the direct and indirect costs of COPD. Effective clinical and public health strategies are needed to prevent COPD and to manage the growing number of people living with this disease. COPD rates in New Brunswick are increasing. 4,500 New Brunswickers are diagnosed with COPD yearly. An estimated 1 in 9 New Brunswickers, 35 and up, are living with diagnosed COPD, representing a 45% increase from 10 years ago. And it remains underdiagnosed due to the lack of screening by spirometry. Now, an estimated 1 in 5 older adults have this disease in New Brunswick. In terms of annual mortality, 2,440 people die of COPD exacerbations, known as lung attacks, each year in New Brunswick. That's over 5% of all deaths. COPD is the primary cause of acute care hospitalizations in New Brunswick, excluding childbirth, at approximately 3,100 people yearly. Our annual hospital costs for COPD alone run at $23 million, or approximately $7,419 per admission. There are more lung attacks than heart attacks admitted to New Brunswick hospitals, and the mortality rate for both is equal. And yet, cardiac patients are 38 times more likely to have access to rehabilitation than pulmonary patients. While there is no cure for COPD, it is manageable with medications, smoking cessation, and pulmonary rehabilitation. Pulmonary rehabilitation, or PR, is the gold standard treatment for COPD. It is a recommended, evidence-based, comprehensive intervention for patients with chronic respiratory disease who are symptomatic and have difficulty with activities of daily living. PR reduces shortness of breath, optimizes functional status, and reduces healthcare costs through improving patient self-management and stabilizing or reversing systemic manifestations of the disease, such as weakness and frailty. Comprehensive PR clinics include patient assessment, exercise training, psychosocial support, and education on such topics as smoking cessation, medication use, mental health, and fall prevention. Pulmonary rehabilitation is useful for other chronic lung diseases, such as, but not limited to, post-COVID-19 and pulmonary fibrosis. Even with rising demand, less than 1% of all Canadians with COPD have access to this important therapy. Barriers to the implementation of pulmonary rehab programs include high wait times, limited clinic hours, lack of personnel, limited effectiveness of referral system, travel distance, facility accessibility, parking, lack of space in hospitals, and lack of equipment. Speaking to limited clinic hours, the St. John Regional Hospital Clinic has the current capacity to see 32 people for pulmonary rehab each year. Our clinic has the capacity to almost triple that. The new provincial pulmonary rehab standards indicate that all people who have been admitted for COPD exacerbation should have pulmonary rehab within 4 weeks. This means an estimated 3,100 New Brunswickers should have pulmonary rehab each year. Currently, St. John Regional Hospital is seeing 32 people, and Moncton is seeing under 20, nowhere near meeting the demand. Most programs are in urban areas, not rural, and held within acute care facilities. Most PR in the province is tacked on to cardiac rehabilitation. In fact, Horizon has 19 cardiac rehab clinics across the province and no exclusive pulmonary rehabilitation clinics. The goals of our current program include to provide better access to pulmonary rehabilitation and reduce burden on the New Brunswick healthcare system utilizing an innovative method. To conduct research that aims to better understand and treat COPD in New Brunswick, and to train future healthcare professionals in effective interventions for seniors with COPD in an interprofessional community research setting.
Over the course of this program, we have developed and refined a student-infused pulmonary rehabilitation model termed the SIPR model. And this model aims to increase the capacity to deliver pulmonary rehabilitation and to provide an educational setting for healthcare students to improve their entry to practice competencies in areas such as communication, clinical judgment, chronic disease management, interprofessional collaborative practice, and in the social determinants of health. Importantly, it was senior health students, so this includes respiratory therapists, Bachelor of Nursing, Practical Nursing, and Pharmacy Technician students who led each of the clinics under the supervision of 2 licensed respiratory therapists. As part of their clinical coursework, students provided education and led aerobic and strength exercises. The passion brought by the students helped motivate our participants to step outside their comfort zone, often achieving outstanding results. The participation of students often allowed the clinic to provide individualized attention, further motivating participants to attend each session, which we feel accounts for an attrition rate that is lower than the national average. With our HSPP funding and our in-kind contributions from NBCC, we have created a solution that helps to address barriers to PR in the province, meeting and exceeding our original expectations. We delivered 9 8-week pulmonary rehabilitation clinics, and we are currently in the middle of our 10th with 2-hour sessions, 3 days a week. The program was overseen by professionals and infused with a total of 233 senior health students. The clinic is community-based and reproducible, where NBCC and UNB health students increase capacity for patients with the ability to now deliver pulmonary rehabilitation to approximately 80 New Brunswickers each year. When St. Stephen was identified as a community in great need of pulmonary rehabilitation services, the clinic was successfully mobilized to the Garcelon Civic Center and to a church gym, proving that it can be implemented wherever there are healthcare students available and residents in need. In terms of evaluation tools, the St. George Respiratory Questionnaire is a widely used tool developed to measure health impairments in patients with asthma and COPD. The 6-minute walk test is a test introduced by the American Thoracic Society and is used to assess aerobic endurance and is commonly used to assess COPD before and after interventions. These measurements were taken before and after completion of the 8-week clinics. And here in this picture, you can see our 1,200 square foot pulmonary rehabilitation lab located in Tucker Park in the NBCC Allied Health Building. And it's just a wonderful setup we have. So these results correspond to our first 8 clinics. So the St. George Respiratory Questionnaire results in 4 scores measuring an individual's perceptions of symptoms, impact on activities of daily living, overall impacts of the disease on their life, and a total score. Our analysis of the data revealed a statistically significant decrease in all 4 of these measures. These decreases also met the criteria for a minimal, clinically important difference, which means that the difference is noticeable by both the participants and the clinician. And the results from our SIPR program are in line with that of standard pulmonary rehabilitation clinics. The 6-minute walk test measures the distance walked in 6 minutes at a normal pace. It is compared pre and post intervention to determine changes in aerobic performance. This test is used in many conditions, such as COPD. With participants, there is a statistically significant increase in average distance walked, approximately 42 meters or 137 feet, after completing the SIPR clinic. To seniors living with COPD, an increase of 42 meters or 137 feet in 6 minutes walked can mean the world. So, some of our participant testimonials included testimonies such as, "Before pulmonary rehabilitation, I had no life, but worse, I had no hope. By applying what I learned daily, my life is fantastic. I am forever grateful." Another participant noted, 10 weeks ago, I was seriously thinking of selling my home. It has 24 stairs. I was gasping for breath by the time I get up to my bedroom. Now I can go up and it's just joyful." And some of the milestones that have been reported here include being able to walk around the mall for the first time in 10 years, being able to use breathing techniques learned in class to improve shortness of breath and avoid calling an ambulance. And 2 of our participants gained the confidence, strength, and stamina to go to Toronto to receive life-saving lung transplantation. On an individual level, we have changed the health behavior and attitudes of a targeted population, improving their ability to confidently manage their own COPD, walking further, feeling fewer symptoms, and having more positive feelings about the impact of the disease on their lives. At a community level, we are changing community norms, awareness, and behavior. The healthcare community is benefiting from the input of health students collaborating interprofessionally in this real-world clinic. Considering retention of these essential workers, their enthusiasm for participants reflected a sincere desire for students to work with this population and even take pulmonary rehabilitation to their communities after graduation. Many of those with COPD who completed the clinic began to reconnect with their community. And at a systems level, we are changing the way interventions are delivered to a community in need. Taking advantage of resources already in place, such as curriculum, students, and space at NBCC, student-infused pulmonary rehabilitation clinics are now achievable and recreatable such that in the future, seniors in different communities could have access. This model can contribute to student training and skills development while avoiding the typically high costs linked to starting such clinics. To improve population health, the SIPR model can be scaled up to include more sites across New Brunswick. It is vitally important that we, as a healthcare community, continually seek out better ways to meet the needs of the clients that we serve. This SIPR model uses minimal resources to ensure the greatest impact. This unique model has been tested in both a proof of concept and as a pilot project over the past 5 years and has been shown to be as effective as regular pulmonary rehabilitation clinics that are led exclusively by professionals in hospitals. This is a homegrown New Brunswick solution for a Canadian problem, a community clinic that has been duplicated 10 times already in southwestern New Brunswick and can be duplicated across New Brunswick and Canada. Pulmonary rehabilitation has been a proven effective treatment that helps decrease the use of acute care services and hospital admissions and has the added benefit of improving quality of life, decreasing symptoms, improving outlook on life, and increasing psychosocial support. Furthermore, by partaking in regular activity, clients experience other health benefits such as reductions in frailty. With our SIPR model, we have decreased the risk of exacerbation in 75 New Brunswickers living with COPD. By extension, if each participant reduced their admissions to hospital just by one, this could save almost $556,000 in direct healthcare spending per year. And this does not even consider the fact that future clinics would have a greater annual capacity of upwards of around 80 per year, and does not consider what the reduction in indirect healthcare spending could be for these 75 participants, i.e. reduction in falls, reduced oxygen and home medication use, reduced length of stay, and the reduction of long-term care with the ability to age in place. This innovative pulmonary rehabilitation clinic is now part of the referral process for specialists, so respirologists, and has already greatly improved access to pulmonary rehabilitation in St. John and the surrounding area. We have been in discussions with Research New Brunswick and government officials about ways to sustain the SIPR program as a long-term research program and as a solution to the COPD crisis. By maintaining the SIPR program, it allows for several benefits, such as high-quality research in pulmonary disease and effective interventions, as well as strategies to age in place, the training of more healthcare students in pulmonary rehabilitation strategies and techniques, development and refinement of student healthcare skills with a consistent clinical placement for skills practice, expansion of these pulmonary rehabilitation services to underserved areas like St. Stephen and Sussex, and the provision of early pulmonary disease screening for up to 1,500 people annually using spirometry. So here you can see the proximity of the NBCC building, the Allied Health Education Center, to Dalhousie Medicine, New Brunswick, the University of New Brunswick St. John, and the St. John Regional Hospital. The interprofessional student-led lab at student-infused lab at the Allied Health Education Center is an excellent site for continued research centered around pulmonary disease and student-infused pulmonary rehabilitation. The co-location of this site facilitates continued collaboration with adjacent institutions through applied research in health. Using our strengths in applied health research and evaluation, we can keep the results current, develop understandings, and improve upon best practices in healthcare. Once again, we would just like to thank you all for this opportunity, and we are happy to answer any questions you may have. Thanks.